Okay, so let's keep looking at the light. Maybe some extra freezing here is going to bite a little. That's the one here. Look at the light. There we go. That's good. You're doing great out of this. Doing really well. Everything's going great. So, J-cannula or nasal. you.
0.9 Henry.
That's the lens going in, my friend. You're almost done here. I go behind the lens, clean up behind the lens, position it. Look at the light. Look at the light. There you go. Almost done. Look above your head. There you go. And we're all done for this one. One down, one to go. Okay, just keep looking at the lights. There you go. No. Keep looking at the light. Look at the light. A little bit of pressure. This is the freezing. Look at the light. Look at the light. Robert, look at the light. There you go. So, I'm pushing some look at the light, just use a chopper to pull it in. So I have a section, nasal, or nasal, delineation, nucleation. Right. Hold this and just fold the epinucleus and put it out to the back.
.6, Heather. Thank you. I'm using the lens as a shield. Yeah, IA.
clean up the anterior chamber. So a bit of polish. All done. Both eyes went great. Okay. Okay, my friends, just keep looking at the light. I have a student here I'm going to be talking to. Mike, okay, look at the light. Look at the light. Okay. So we do a self-sealing incision here. You get an egg.
Come on, what's this?
A bit of pressure. I'm going to give you some extra freezing in a second here. Okay. Look at the light again. Look at the light. There you go. I'm going to give you some extra freezing here. Just keep looking at the light. Look at the light. A bit of pressure. This is the freezing. Just try to dilate your pupil a bit more. Okay. Try to not to
really
make.
wanted the IV sedation. I don't know why I'm getting this.
Okay, so okay, just look at the light. Can you give me some tetracaine, my video, Heather? Tetracaine. Okay, here you go. I'll give you some extra freezing in a second here. Okay. People nicely dilated, so it's good. Yeah, minimum, yeah. Yeah, it's okay. I'll put some more drops here. Okay. If you can look at the light, that'd be great. It makes the life much easier, much more accurate. There you go. That's good. Perfect. Okay. Excellent. Very well. Look at the light, my dear. Okay.
32 more times.
Doing really well. Everything is going great. I'll give you some explanation later, okay? Because it's Nick, can you lower the volume of the QRS? Yeah. Yeah. Put it at 1. Yeah. Point 0.7 EFX. .7. Look at the light. Look at the light. Here you go. This is the lens going in. We're almost done here. Doing great. All done for this one. Did great. You look at the light. Okay. Let's get started. The pupil is not full. We'll get some more with the xylocaine phenol. See the angle is angled this way, so it's self-sealing that way. A bit of pressure, my friend. This is the freezing. Just bear with me for a second. Okay. Try to look at the light. I know it's not easy, but just try your best. Bit of pressure, yes. Doing really well. Everything's went great for the first one, so hopefully this will do the same. You enjoying the color show?
Yeah.
Okay.
Taking out the candy, the chocolate out of the middle, but he's leaving the candy coating there. And then we'll put a lens in where we took the chocolate out.
Oh, that's a good way to think about it.
Yeah. She's been doing that for a long time.
Yeah, I've been around.
Yeah.
How long?
Oh.
The DOR, 34 years.
34 years.
Yeah. Yeah. Long enough to know better.
Nursing how many years?
36.
Oh, so you did 2 years and then went straight to the OR. Oh,
Yeah.
Things have changed a lot since I started.
Yeah.
Biggest change.
Well, technology's changed a lot. Staffing ratios have changed a lot.
Yeah, is it better? Yeah, that's it.
We have more staff, but we do less work. We have more staff.
I see.
Management used to be like, the top dog in the department became the head nurse. Now they hire managers that don't work in the departments they manage. They just sit in an office. They got no idea what goes on in their departments,
Right.
which doesn't work.
Yeah.
So they never stay. Like I have 34 years in the OR. I think I've had 30 different managers.
Yeah.
They all leave within 2 years.
14 years I've been by at least 10 to 12.
Yeah. And one of those things is 6 weeks.
See, the best case scenario is
That's the longest one.
Yeah.
Wow.
yeah, the best case scenario is for one of the OR nurses to become a manager,
But there's no
but
incentive.
no incentive. So this.
What do you mean this?
No, you're out of the union. You're not
Did you
protected.
do you inject something?
Oh. Maybe not.
Uh-huh.
I was chatting.
Yeah.
0.7, Heather.
Yeah, I'm not sure if it's going to work or not, but pushed forwards. No, it's not messed it. Yeah. I need another lens.
Can you give me another lens? Heather, the same one?
Yeah.
Sorry, I
Yeah.
messed that up.
What's number?
19 and a half. Yeah. Yeah, if you don't inject it at the beginning, the plunger will bypass the
it's
thing
stuck,
and it's
right?
stuck. Yeah.
Yeah.
Stuck. Yeah.
Are you supposed to do something with this one?
I don't know.
ECU 19.5.
Yes, expiry 2018, 2028, 2028.
I hope not.
No, 2018. I'm the kid late. That's good, thank you. Look at the light, my friend. Look at the light.
Okay, now I've lost the track. Hey, can you take my chart, right?
No. I think it's there. Nothing. Here.
What's there beside the lens?
No, those are the next ones.
Did you take it with you out to pick the lens?
Oh, no, it's right here.
Oh.
Keep your hands down, keep your hands down, keep your hands down. We are
Keep your
working.
hand down.
Yeah, we're
Keep
working.
your hand down. We're almost done.
Yeah.
Don't scratch it.
Hey, hold it off. It's just a few seconds. All done.
Yeah, after 2029 is better.
Okay. Okay, so we're gonna use the ring to fixate and to angle the knife depending on the corneal thickness and diameter. So thinner corneas, I angle more. Thicker corneas, angle less. Can I have the local? Oh, okay. Yes. Okay. That's good. Thank you. Thank you. Give me some extra freezing, my dear. You gotta bite a little bit. Yeah. Gonna bite a little bit, that one, my dear. This is the freezing. So we're gonna, this was a mix of xylocaine and phenol 10, both preservative free. This is what's called endocoat. So it's a thick material that fills the eye, protects the cornea iris, and we're gonna protect the front of the cornea so it doesn't dry out. So nobody need to keep putting BSS on the cornea. So the second incision, it should be as small as possible, just enough to let the second instrument go in. So mine is about 0.9 millimeter. We mark the cornea, so it's the opening should be appropriate to the size of the optic of the lens. So it's typically 5 millimeter, okay, and the lens diameter is 6 millimeters. So you have half a millimeter overlap, and that improves centration and decreases the chance of PCO, posterior capsule pacification. This is one of the most critical steps in cataract surgery. Because if you have a good one, you usually have good results. If you complicate this area, it's, you end up with a complication that you don't want to have. Capsule is king here, so capsule is very thin. It's anywhere between 3 and 20 microns thick, so that's very, very thin. This probe is the phaco handpiece, and irrigates, aspirates, and vibrate. The vibration is 40,000 times per second, so okay. It breaks up the cataract. The tip suck it up, and the sides bring fluid in. So it's a continuous flow, and it brings the material out. So when you hear that, this is the ultrasound. So we have to protect the capsule, as we'll explain. So after I remove the pieces, I see my choppers on the back there, protecting the capsule. Okay. So the nucleus and epinucleus are gone. Then I'll do a cortical cleanup. I use the J-cannula for that. So this irrigates only, and the material will come out from the wound.
Right.
So along the shaft of the jet cannula, so without aspirating. The idea is that aspiration is the one that can capture the wrong stuff.
Right.
So I try to avoid that by doing irrigation only, and the material will, with the fluid dynamics, they know where to go. They go out. There's no other way. So. And now we're injecting a different kind of viscoelastic. It's the fibers of that one looks like a spaghetti. So when you capture part of it, it just drags the whole thing out. So it's easier to remove at the end. Okay. The first one, it looks like a macaroni, so it's small little pieces. So you will not take it out easy. So I hold from the second incision, push in, and inject the lens. Have to make sure that these two legs are there, because sometimes this injector eats one of the legs. So you have to make sure it's there before you inject it. Otherwise, you have to do an explantation immediately. So both are there. And now this is irrigation aspiration. We did most of the job with the J-cannula. This is just to remove the viscoelastic mostly, and I use the lens as a shield to protect the capsule. Again, the capsule is king. So I have to protect it, and using the lens as a shield and move it around. Yeah. I do a little bit of irrigation in the chamber here, because something might be hiding and I didn't see it. So the blind irrigation will take it out. I remove the undercoat that I cover the cornea with. I do moxihydration. This is a moxifloxacin. It's a 4th generation quinolone. And I hydrate the wounds with it, so it gives you a huge dose of antibiotics at the wound, and it hydrates the wounds, blocks the wound. So, and this is what I call dropless injection. So this is a mix of steroid and antibiotic, the moxifloxacin again, and some freezing too. And that helps a lot, so that the patient, they don't need to put drops afterwards. Okay, so this is a depot, and keeps releasing the period after the surgery, so the patient doesn't need to put 5 drops. Okay, my dear, keep looking at the light. That's the best thing to do today. So again, my friend is gonna open a self-sealing incision. Her cornea is slightly thinner, so I angled more. A little bit of pressure, my dear. This is gonna bite a little, that one. This is the freezing. That's the one. Yes, it bites then freezes. So. The undercoat, the viscoelastic, fills the chamber, protect the cornea from the front and the back. There you go. You're doing great, my dear. Okay, doing really well. Okay, that's great. Second incision, 0.9 millimeter. The first one is 2.7. This is 0.9. Just enough to introduce the chopper. Cornea mark. So this is called capsular where we open the front of the lens. So we'll do a hydrosection, which is separating the cortical material from the capsule. This is upper nasal, and I introduce, lift, and inject, and this will split the layers completely, and then rotate the lens, and then hydrodelineate, which is splitting the nucleus from the epinucleus. Okay, that's good. Doing great, my dear.
Okay.
Yeah. So this is the phaco hand piece now. Okay. So divide, chop. This is called chopping technique. Chopping technique. Yeah. So we chop the lens into smaller fragments and remove them in pieces. Most of my action is happening in the middle of the pupil, in the pupil plane, away from the capsule, edge of the capsular axis, away from the edge of the iris. So most of the action is happening here. It's the safest place. So I bring the stuff to me, okay, so that you stay away from trouble. And I always do the second instrument to move stuff around, make it safe, bring it closer to where you want stuff to happen. And at this stage, so the epinucleus is gone, you want to protect the capsule. So see my chopper is behind, protecting capsule. Again, capsule is king.
0.6.
J-cannula, you have to make sure it's very tight. Everything has to be tight, otherwise it can eject. You don't want to see an ejection, so. Okay. See it splits, cleans up, and everything comes out from the wound. They find their way because of the fluid dynamics. So you don't have to suck it when you're inside, because when you do suction, you suck anything. So iris, capsule, can open the capsule, result in a complication, which can be avoided by doing a slightly different technique. Definitely J-cannula is not the standard that everybody uses. It's very few in the world that uses J-cannula. They mostly use IA, so the tool I use at the end with the lenses in, they use it to clean up. Problem with that, when they are cleaning the cortical material, they can capture the capsule and open the capsule and result in a complication. So that can be avoided by doing the J-cannula, so I avoid that. And now when I use it, I have the lens as a shield inside, protecting the capsule. So now I'm doing irrigation, aspiration, so it irrigates from the side, aspirates from the tip. But I'm using the lens as a shield, so I'm moving the lens with me, making sure that when I clean up, I'm not risking the capsule at all. And if I need, for example, you can see that little piece here behind the lens? You can see that piece here. I'll just irrigate it, get it out, okay. So I'm irrigating behind the lens. Almost done, my dear. Okay, here we go. Done. So I didn't have to do any aspiration there. I just irrigated it out. You can see the very clean capsule. There's nothing there. So everything is doing well, my dear. Almost done. Yeah, almost done. A few seconds. So this is the moxie. Yeah, after I leave here, go straight there. Yes.
Okay.
That was moxie hydration, and this is the dropless injection. So injected outside, so I can have control over it. It prolongs the effect and doesn't blur the vision. The original description of the dropless is injection inside the vitreous, which fogs the vision, and I do bilateral surgeries. Okay, so look at the light. Look at that, my dear. Look at that. So because it's ectodermal, the lens in origin is similar to skin. And skin ectoderm keeps growing throughout your life, right? That never stops. Same here, so it keeps growing throughout your life. compressing the cells in more into the center of the lens. That's why at the age of 40, it becomes too compressed to move, and you get the presbyopia. Okay, and then move forward, it becomes more cloudy. Start getting the cataracts. So that's why anybody lives long enough to get a cataract, because of the nature of that, where that lens came from. So it's ectoderm. Look at the light, my friend. Look at the light. There you go. That's the only job today. Remember that. I want to do my best job, and that's the best way to help me do that. Good morning. Hi, Katrina. How are you? Good, good. How was your night?
Great. We just went to Chocolate House there, just did like a little appetizer.
Oh, that's a nice one, huh?
Yeah.
It was so busy, and
At that time, not too bad.
no, it wasn't too bad. See, there was a value of delaying you from going.
True, thank you.
Yeah. Otherwise, during the peak hour, it's very noisy. You can hardly hear anybody. Yeah, seriously. See, always there's a benefit to it.
Yeah, there's
Bright side.
a bright side.
Uh-huh.
So,
Oh, good. Oh, good.
2024. That's the left side.
So, any other questions?
What made you want to get into ophthalmology?
Oh, that's. I think it's the best lifestyle.
Oh yeah.
Yeah.
Like on paper, like I've seen that.
Yeah. Yeah. No, it's the best lifestyle. I like the shorter surgeries, easier follow-ups afterwards, happy patients. Yeah. And it has the medical part and surgical part, so we have a lot of medical things we do at the office and a lot of surgeries we do. And so, in addition, laser has a lot of technology in it. It's, every year we have new things, new testing, new investigation, new lenses. So it's very exciting. So, for example, now we have the 3D microscope, which is in my next move. Yeah, it's a digital microscope. Now we're using optics, right, to see. But the other one will be something that you wear on your head, like a VR set, and you can see through it, three-dimensional, and you have enhancement, and everybody can watch the same thing. So you'll be standing here seeing exactly what I see.
Oh wow.
Yeah, so because it's a three-dimensional, it can broadcast it anywhere. But look at the light, my friend. Look at the light. Here you go. That's the best thing to do. So this is my next. So there's always exciting technologies coming up. It's a very dynamic specialty. Yeah.
And are you from Cornwall?
Yeah. Been here 18 years now. My family is in Montreal.
Okay.
So when the kids started to go to university, we moved the family base to Montreal. So I go there in the weekend. Weekdays here, weekends there.
Nice.
This is the lens going in. Doing really well there.
Katrina.
Yeah. You and I can come here, and her can go in the hall. But that's the only thing. We'll see what we can do. We'll talk. We'll first. Yeah, we'll find a way.
I'll keep a little invite.
Anything else, Porto? Uh-huh.
What do you enjoy outside of medicine?
Hmm?
What do you enjoy outside of medicine?
Outside medicine? Oh, a lot of other things. So I love travel, photography, droning, technology, all.
Where have you traveled?
Most recent was Bermuda. Was just a quick.
Bermuda.
Yeah. I didn't see the triangle there, so it was fake.
Yeah.
Look at the light, my friend. Look at the light. There you go. Like droning. Like drones.
What we're trying to do is send somebody home with too many. Oh, I see.
Well, probably to replace.
So the air bubble will go away, and the whitening, this will go away. Standard.
Why do they have
That's good.
6 and a half?
Okay. All done. One down, one to go.
Try 29 for the right eye.
Okay.
So, Partha, can you give me the steps of cataract surgery? That's a pop quiz. No, I'm talking to Partha.
Good.
Put them on the spot, okay?
Put like 4 or 5 liquids in there.
Okay.
You just take it out.
So let's do it step by step as I do. Okay. What is that step? I should have give you a warning so you remember. I'll let you go. Don't worry about it. That's okay. Let's do next time.
Very good.
Okay. Let's do. I should have warned you about the pops quiz.
Right.
Okay, so it's paracentesis. It's the second incision. 0.9. Look at the light, my friend. You need to have the rexus very well centered. Otherwise, you're going to decenter the lens because unequal scoring. So these are very critical things to do. I'm obsessive compulsive too, so decentration bothered me so much. If you want to drive me crazy, just tilt it, photo frame or something.
When this case is done, we'll be done with this shortly.
Okay, okay, so I'll just get ready to turn over then, and
Sure.
then I'll take over, okay?
Okay.
I'm just gonna go,
Yeah, come back
few
in,
minutes?
come back in a few minutes.
I think this is the chopping stuff.
So this is the chopper. Okay. So what I do in this, I adjust the lens, put it in the middle, impale it, and then with the chopper divide it. So I'm using the phaco to fixate it, and then I move it. So, and then I use the chopper to move stuff around to bring it to the phaco tip that's staying in the middle, away from trouble.
Point 0.9.
0.9?
Yeah.
Because everything you do, they just send brought down. Should be bad.
what is, no, it's just for me.
Oh,
What is the other? 4326?
for 4236. Try those.
4326?
Try it. Oh. Are those sweet? Yeah, that's the one. That's a good sign. You might go
And we're all done. Okay.
Is that for the,
Look at the light. There you go.
is that for the other eye? Is that for that eye? Then don't give it to me here, just flip it on my table, please.
Have a local somewhere? Oh, sure. Okay. That's good. Here.
Mine.
Why the GoPro? Why the GoPro?
It records the movement in general and the instructions and this kind of thing. I like I like photography, right? So the microscope view just records this what's happening inside, but doesn't record what's happening outside.
What do
So-
you use the recording for?
It's education, yeah, education. So I do some presentations, these kind of things. Yeah, yeah, it's education. That's I have a lot of YouTube videos. So
Oh, very cool. Do you have a YouTube channel?
yeah.
Oh, no. Is it just called Dr. Youssef?
Pardon? Doctor, yeah, Tarek Youssef, yes. Yeah. Typically, I would work on this on the weekend, and you find it on Saturday or Sunday. And you're not sure which gonna become the interesting patients, right?
Say that again, sir?
You're not sure which will become an interesting patient.
Yeah.
So sometimes it's all routine stuff, but you can't forecast what's gonna happen, right? So record them all.
What would make the patient interesting?
Some weird happening, complication, these kind of things, special things. That's hopefully we don't have anything interesting today. But it's a surgery, so stuff happens. So sometimes you need to, for example, to educate myself too. Something happens and I don't know what happened, and I just go in the videos again and review it again. And then I learn from my mistakes. So yeah. So always record it. These days it's very easy to record those. So it doesn't make any sense for us not to do it. So you notice that this is a harder cataract than the previous one. So it takes us a little longer to break up the cataract. The longer the cataract is staying, the harder it gets. And it goes with the age of the patients too. So the older the patient,
2.6, please.
so this number she's saying is EFX. This is a representation of the amount of power we used, the time we used it for during the surgery. The higher the power, the more harder the cataract was. So all morning today's was less than 1 usually. This is the first 2.6 one. Okay. Wow, excellent folding, my dear. Wow, way to go.
It was preloaded.
Yeah. You can mess up that one too. You can mess up that too. It did happen. Yeah.
With
So,
the preloaded?
yeah.
Oh, God, I better
She
not.
forgot to put the physical elastic in.
Oh,
So that's messed it up. Once I push it, it's gone. So yeah.
okay,
Yeah.
well. I am the worst person at folding lenses in this whole operating room. So whenever he's like, oh, you didn't mess it up.
The cheering is there's a reason. There's a reason for the cheering.
Can I see how you fold them next time?
So these are preloaded, so
preloaded.
hopefully I won't be here to load one.
Okay.
Bonnie will be back,
Okay.
and you can watch Bonnie.
Okay, cool.
So there's a reason for her to come at this particular time, right?
Yeah. Keeps everybody happy.
Yeah, there you go. There you go.
So already preloaded. We should be safe. We should be safe.
As long as you remember to put the stuff here.
Okay, look at the light. Okay, so yes, it's not gonna happen. Okay.
Twenty.
So, for example, here she's not going to look at the light. I can't tell. Don't know how to tell her to look at the light, and she's not responsive. So I'll use this to centralize the eyes. This is the second use of the chopper. I try to minimize the number of instruments, so one instrument can serve as multiple purposes. So you double this as a fixator. So. So the idea of the rexus to be appropriate size is that you want it to just overlap the lens. So the lens is sandwiched within the capsule and covered 360 degrees around.
Right.
So it doesn't let cells grow around the edge and opacify the capsule. So that's the idea of. So if you make it too small, it's going to make your surgery much harder.
Yeah.
And you will not be able to do it safely because you can capture the lens, the capsule while you're working. If you make it too big, it's not cover the lens. Okay. And there's some complications. You would need the appropriate rexus size because it's you're going to implant the lens and you use that rexus to capture the lens. So you want it to be appropriate size.
2.7.
Continuous irrigation.
See here, the lens is always between me and the capsule. Okay.
Yep.
So, yeah. Shoot.
No, I just didn't put them in the garbage to save room. And then we just made a stack of them.
See, the rexus is covering the lens optic. Okay.
I'll do that right. Okay.
Like we usually, what's that?
Yeah.
Should put the antibiotic point of incision.
So it stays there as a depot, and infection goes into the eye through the incision. So you have that sentinel sitting there waiting for anything to try to come in. So this way, yeah. Feel a bit of pressure. This is starting the surgery here. See, because of the thin cornea, I have to make the wound a little bit longer.
Yeah, does it?
Yeah, so I'll give you a bit of extra freezing. This will bite, my dear. Okay, there you go. A bit of pressure, that's normal, yeah. Doing very well. Everything is going great here. So.
I need one extra.
Hmm?
I know you mentioned you like technology.
Yes, yes.
How do you think AI would enter to
Oh,
this type of surgery?
Oh yeah, so the coming up, the stuff is gonna be an AI attached to the microscopes. So for example, for this surgery, you're gonna have an AI that assists you. Oh, you're coming close to this part, so okay, it can guide you actually through. So especially at the beginning of the career. So that's one thing. The AI already have in the calculation of the lens implants. So some of the formulas are AI generated, but to calculate the lens implants. So this is AI is coming up for sure. In investigations, it's going to be AI in the OCT and AI fundus cameras to help you make a diagnosis and monitor and analyze. your results. So there's a lot of AI going to be helping us to make decisions, guide treatment. Yeah. It's definitely a plus for us. Yeah. So you won't be able to stop AI, so you have to embrace it and use it to your advantage. And
Absolutely. It is like
yeah.
a scalpel.
Yeah, exactly. So you can use it for good or bad. So you can.
Use it for good today.
Yes, that's what we're doing. Yeah, that's exactly it. See, her pupil is not too big, right? Because of the cataract is softer, I'm able to do it without having to dilate the pupil, as long as you have enough rexus to do that. Okay, if it's a harder cataract, I have to dilate the pupil because I want to see the whole thing. And the nice thing about the J-cannula can actually clean up areas that I don't see.
Oh yeah, for sure. That's me.
Doing really well, my dear. I'm ready to implant the lens and be all set soon.
Point 4.
Is it sign for the winner of the group? Covering myself.
Oh, okay.
There we're all done. One down, one to go. That wasn't too bad. That's good. Just keep looking at the light here. So that's good. So thin cornea, angle more to the apex. I'll keep looking at the light. I'm gonna give you some freezing. This will bite a little bit. Just bear with me. Here it comes. That's the one. Inject me. Feel a bit of pressure now. That's normal. Yeah, that's the normal at this stage. She has a shallow chamber, so I enlarge the chamber a little bit to allow me to do surgeries safely. Yeah. You're doing great. Everything's going well, my dear. So, doing great.
I always do that.
We're gonna sign you up for all the other ones.
Yeah, sure. Sounds good. Sounds good.
You have to tighten that very much.
0.3.
Make sure it's very tight.
Looks like guppy fish.
Yeah, you have a lot of stuff that's happening in the eye, and you see a lot of beautiful colors and shapes.
Yeah.
Yeah. Now the lens going in, it has the kaleidoscope kind of effect, kind of. So
Yeah.
it's pretty neat. It's coming in. Oh,
For the first one, I'll let you.
bit of pressure.
Yeah, so you'll have to go back and do it at the end of the day.
Here it comes.
It's
Nice and kaleidoscope of colors.
There you go.
the one that we're
That was the lens then.
I'll let you just do the incision size. You can focus on that. I've got another computer in there ready to go. And then the second one, you're going to do both. I looked them up.
That's pretty cool.
So
Yes, it is, huh?
I
Okay, that's good.
everybody does that. So it's up to you if you do that or not. The more proficient you get, you'll have the time to do it. But we're going to just focus on everything that we're doing, all that stuff. So we're going to do it today. I'm going to do it for the rest of the day, but yeah, that's right. And then that way you're going to be, the next time you're here, you're going to go. Okay?
Touch the microscope, so just keep it aside for now.
There's extra staff too, so it's the perfect day for it. Yeah. Happy with that.
Nothing more, 66 bilateral cataracts, no sedation, and she'll go back to day surgery.
I can take your Phacoemulsification.
Yep.
It's I lost the tip, so
It's in
yeah.
your lap there.
Okay, there. All done. Good. Okay, that's good.
You're the only doctor that does this here, right?
Yes, pretty much, yes.
Okay, so exactly. So you gave me one
Okay, that's good. I'll give you something extra freezing. It bites before it freezes. Okay, just bear with me in it. Okay. There you go. That's the one.
that popped up right there. You want one, right? Oh, it's because you're micrograms here. On the body part.
So how long does it take?
Usually about 5 minutes.
Usually.
Yeah. Depends how much hard time you get me. If you freak me out by moving, I will slow down, so it takes longer. So try not to freak me out.
Like, since up to date.
That's how I lost my hair. So,
I know you. I heard you were the best.
thank you.
I just write the date on it for today,
Yeah, perfect.
and then an initial.
So, okay, so you should have them on 10. I do 10. Put it there. Perfect. So you can put 10 there. Great.
So I don't even see, but that's how smaller ones.
Yeah, I think you could
Just put it.
Just little.
Okay. There, right, perfect. ECG,
There's
does
a
it
little
look
bit
like
of
it's
a knack
inside?
to
She's
holding
inside
it to get it to go into here.
Yes, I heard it.
It looks like science to me. So you can
Yeah,
click on that and put NSR.
makes you swear.
Okay.
It does it.
You're caught up for this part, okay? So I've charted this. I am gonna chart that bag out.
Kind of like yoga legs. You're gonna fold one, fold
Yeah.
over top of the center.
I can put an order in for that right here, Dr. Youssef.
Yeah.
Thanks. You're the best.
Yeah, thank you. Doing great, my friend, my dear.
So should be.
It's we're doing really well. We actually started the surgery, you know that, right? And everything's going really nice and dandy. So we're gonna keep it that way. Yeah. Doing really well. Everything's going great.
Sorry, you mentioned before why there's no incentive to pursue.
So,
You were mentioning before why there's no incentive to pursue.
your management job, there's no safety in there, no law managers, there's no notice, no anything, and the pay is actually less than what they would make as a staff member.
Oh, really?
Yeah. Like the staff nurses here do a lot of on call,
Yeah.
so they didn't probably double on in a year.
Oh, right. And there's no union or anything.
No union protection for management. So people that know the place don't want it because there's no protection there.
Yeah.
But you need somebody to manage the place that knows it.
Right.
So, administration should recognize that.
Yeah.
Pay somebody appropriately
Yeah.
to who's been there, has done that, who knows how things should run, but they don't. So, but it's not unique to this place. That's most of ours are the same.
It's a system problem. It's a system problem. They have to tackle this. Otherwise, it's got to be repeating. It just doesn't make any sense.
Yeah.
When they explain to me why, and it's
Makes no
makes
sense.
no sense. But their voices, I'm not sure it's reaching them, the administration. I'm not sure if it's they're getting this kind of feedback.
Yeah, hospitals are not run the way that they used to be run.
Okay.
Things ran better 20 years ago,
Right.
honestly.
We need somebody that is ready to change and shake things, and change the rules and change to advance us.
He knows. I've been a nurse for 36 years. He knows.
My dear, everything is going well. I'm ready to implant the lens, by the way.
Almost, 25 years in RN and 30 in I was in
You've been a nurse for 50 years? I'm just kidding.
That's like Nick telling me upstairs that it's my 60th birthday next month and not my 50th.
Nice.
You've been a nurse since you were 10?
Oh, Brendo. How
She was playing.
we're working on bonus points today.
2.1.
That was the lens going in, my dear. So doing really well. It's good. You're not as bad as I thought you will be.
Well,
Appreciate the help and cooperation.
yeah,
Yeah.
I appreciate the extra help.
No problem at all. Pleasure, my dear. Okay.
And a lot of procedures that we used to do were inpatient procedures, hernias and gallbladders and stuff. Now they're all day surgery. They're all home, 2 hours post-op. They're gone.
Yeah.
And even total joints would stay in for a week, then they go to rehab. Now they're home same day.
Same day for
Same,
Always
same day.
these
for
weird
most
shapes.
people.
A lot of weird shapes.
Yeah.
That's normal. Eh?
That's pretty normal.
It's crazy. Like,
Pretty
and
normal.
then,
Yeah.
surgical site infections have increased
You're not allowed to do
over
it.
the years. Part maybe because people are going home and not looking after their incisions and not, you know what I mean? But they're not educated-
Dropless, guys?
Dropless?
Dropless?
They're not educated to do that. But that's just the system, right?
No worries.
Like a lot of things have changed to speed things up, but whether speeding things up is for the better, for the patient in the
That's
long
good,
run,
that's good,
I
thank
don't
you.
think so.
That's fine.
Like, it is definitely a balance of like getting more people inside.
Yeah.
But like, no, I see what you mean.
You know what I mean?
Yeah.
So if I look once you finalize this, let me see, you might actually already be in here. I'll refresh. You're gonna see the midazolam, you're gonna see the fentanyl here. You just don't see it yet because you're
And we're all done, my dear. One down, one to go. This is too bad, huh? That's good. Okay, let's keep looking at the light. A bit of pressure. There we go.
Hey, you know what I heard on the radio?
Try not to move. No, you're moving too much.
I had it on shade.
That's us. There we
Feel it
go.
more on this side.
Yeah, I'll give you a little bit of extra freezing. There you go.
Yeah,
Can you
you didn't win.
can you give another 25 mics of fentanyl?
It was like a trivia contest to win concert tickets.
I'll give you some extra stuff.
Saskatchewan.
Okay.
In Saskatchewan.
Yeah,
Fentanyl.
but he got questions that I would not have gotten. Like it asked where Leslie Nielsen was born. It asked what NHL player
That's good.
on
Thank you.
the Canadians has won a Stanley Cup already.
Yeah.
I didn't know that. It's Newhook. I would not have guessed that because he's young.
What was the game score yesterday?
4-0.
Painful,
Not
painful,
good, not good.
painful. I saw the first 3 goals. I thought, okay, that's bad. I'm not gonna. I'm
It
gonna
was
go.
2-0, and they were all over them, and I didn't stay up to watch it. 'Cause I
So it was
tired.
the, and I had the early morning, so I have to.
Yeah, I was like, you know what? No, this isn't worth it.
And the 3 was really quick, so
And it's so
yeah.
funny because sometimes they're like dominating. And
Yeah.
sometimes they look like they're, you know, pee-wee players. Like,
Uh, so
it's not good.
so what makes us this way or this way?
I don't know. I don't know. I don't know if it's the coaching, if they changed the style of coaching, but I think they should have had Jackai and Gallagher play.
Yeah,
Because they have a presence, I would think.
yeah,
You know?
yeah.
I find like Dobson, since he came back from the injured list,
Yeah,
and he's
uh-huh.
on my draft pick.
Yeah,
and
uh-huh.
he's done squats. Since he came back. They should have left Jackai there and left him on the injured list.
Yeah.
Because he's done nothing, absolutely nothing, since he came back. I think he's caused more goals.
I haven't.
He's caused more goals than he's
Yeah.
helped with. But they're getting manhandled out there.
Yeah. Or,
Bad.
I don't think it's set up.
Hey, do
It's not running. It's not running. Give me the tip.
you want the tip? It did
Let's,
it did do its thing.
Okay, that's not.
It
There's
did
no
try.
Phaco. No Phaco.
Just two.
Just tune, yeah.
Sometimes it misses one.
Oh, prime low vacuum error.
Okay, so that's a
So
so
sometimes
prime.
it doesn't capture all of
So
them.
during prime, yeah.
Prime low vacuum error.
Bypass.
For what? So you're gonna go.
So one
these
trick is
actions
to connect
and
it
stack some.
end to end.
Yeah. Easy peasy.
It used to make like a certain noise when it didn't prime
Yeah,
properly.
sometimes we are talking and you don't hear
Yeah.
it. It's, we don't
But
expect
it used to be
anymore.
like a.
Should be more loud and verbal. Okay.
I don't know.
So, okay, there we go. Okay, try to look at the light, my dear. Okay, there we go. Doing great. Everything's going well. We're gonna keep it that way.
Okay,
It's a good
so
rhythm
now
we
we're
have.
caught up, right? So what I would be doing is I'd be looking the next one up, which I've already done. Okay. You're continuously monitoring your vitals here. I like to keep this as like my dirty workspace, and I like it down when this is done. Toss that up there. So she's still in sinus. Blood pressure is good. I know it's good because I looked at what it was before you started. It's actually, well, it was 126 over 86. It's a little bit high. I'm not too worried about that. 151 over 85 isn't crazy given the circumstances.
Doing really good, my dear.
1.3.
It's just
So I heard that the EFX went off. The lens is going off. Right? And then as soon as you see that that lens is unfolded, smash the BP button. So for the next one, you're going to do
excellent. Okay. Doing really great. We're ready to implant the lens. We'll be all set for go home.
good. Okay. And then this one, for now, yeah, but this was an adaptation to study, which is fine, because if you ever go down to endo, that's how it's going to be. But they'll have you like, just put it on that little brush thing, you know what I mean? So yeah, so here's the lens. So this is like the most critical time of the surgery, so we ideally don't hit it until it's unfolded.
I can put now, that's fine. Okay, good.
done within the next minute. So your last blood pressure, it should be perfect. Like the timing for it. So we could probably toss these. So we're wasting 2.5, right? We're wasting 0.5 or 1 ml. Yeah, 1 ml. You cool if I toss these, buddy? Okay. They're gone. If you're ever going in, yeah, so you gave 2.5, we're wasting 2.5. So the midazolam does go in that degree as well. So you can, for eyes, usually that's the one I would pull. You weren't wrong to grab a 5, there's nothing wrong with that. This. Exactly.
And we're all done, my dear. Everything went well, great. Okay, so at least it has to be at least the size of the rexus. If it's smaller, I'll dilate the pupil. Bit of pressure. This is the freezing, my friend. It bites a little, that one.
Maybe some would be a 4.
Yeah. I'm a 4E depending on the day.
I want to be a 5E.
You want to be like dead? Dead. And then, you did erase all of it. Yeah, so right after. No. So we're not going to start an IV, so you can remove it. Yeah. Usually if
So the size is appropriate, so we don't have to dilate.
Okay, so
let's say you try to put
so you're going to have documentation. And you're going to see all these different actions, cool. Always starting you can't do a measurement for that side. If for whatever reason your vitals are informed, you can monitor it. And you go physiological and you go.
I like doing that.
Monitor physiological.
So having a smaller pupil like that, so everything happens to be strictly in the middle. To avoid any injuries to the side, to the pupil edge or rex's edge. So impale the center, chop, okay, rotate, chop again, rotate, and then get the piece in. See, it's in the front now, so it's you can see what's happening. You can see how the pupil is doing. It's just flopping around a little, getting smaller, bigger kind of thing. That's what's called floppy iris. Floppy iris. IFS, intraoperative floppy iris syndrome. Intraoperative floppy iris syndrome. IFIS. So a lot of times it can happen because of the use of alpha blockers. Because the dilating muscle that dilates the pupil is alpha agonists. So alpha blockers used for prostate medication and stuff, they cause that to happen.
I think they're sending Rob home,
Oh, okay.
but maybe not if Heather's going then. I don't know.
No, I need Kathleen, because I said Kathleen's is going to be responsible.
So the nice thing about J-cannula is that it can clean the areas that are behind the pupil without actually seeing behind the iris, without actually seeing that area. But at the same time, be careful with iris prolapse because you can push the iris out of the wound. So you have to be careful watching it.
To Rob.
Make sure that so you don't push it out.
Am I just staying in here? Like
Yes.
nobody else is coming in?
Doesn't look like
Okay,
that.
that's fine.
Okay, so that's
As long
good.
as you're good with that, eh?
So we're good there.
So how did you go home? So you're gonna be solo, but I can still help.
Well, you know what I'm saying? Yeah.
Yeah.
Well, just they send the casual before they send the regular. Yeah. Know what I mean? 2.6.
So we're overstaffed today or what?
Yeah, way overstaffed.
Why is that? Was that somebody room's
They're
cancelled?
overstaffed, but they called Steve in on overtime.
Seriously?
Yeah.
Seriously?
3 to 11. They called him in on overtime.
Perfect management.
Yeah.
Anybody else?
Working all day?
Yes,
Well,
he's doing it double.
he's 3 to 11. I'm very confused.
Does not make any sense.
Yeah. Leadership at its finest. 2.6. Yeah, I couldn't remember it was out of one.
Continue irrigation on.
You did tell me-
So the Rex's size is appropriate to the size of the lens.
When it went out.
So we did the right decision by doing this. Okay.
Okay, so after this case, yeah, last one. Exactly. You're not doing that. You're not doing that.
One sec.
After this case is done, I'm gonna send it for lunch, right? Okay. While we still have H dog. Okay, that's it.
Well, at least that makes me feel.
So lens is in. Hit it. Hit it. Hit it. Hit it. Yeah, and how is it feeling right now? You feel more comfortable with it? Good. It's gonna be fine, and then every once in a while you're gonna hit in like a snafu that slows you down, but the more you do it, the more you'll have. You know what I mean?
There we- Oh, done for this one, my friend. One down, one to go.
Sometimes like
Yeah. Okay, see if it's gonna dilate a little bit more.
I do, yeah. Little critical thinking, you know, like
Bit of extra freezing. It's gonna bite a little that one.
they are gonna train you. Good, good. I think you'll like it. I think you'll like it. Who's gonna train you? Who? Yeah. They're gonna put you in the apps, I'm sure. Yeah. You're part-time, you gotta get but do you know who's gonna train you in recovery? You should get Renee.
How long is her temp?
Renee or Monica.
Okay, so it's okay.
But she's standing this one.
Yes. Yeah. If you're not getting a lot of scheduled shifts too, you can always ask for some cross training.
I like
They
it.
are, right? Good.
Okay, look at the light. Look at the light. There you go.
That's awesome.
Oh, I probably walk by
Yeah,
her.
well, yeah, for sure. And you're gonna have a full picture with you. That's great.
He grew up on Susan. Okay. So he tells me who and where.
The OR course?
So Nicholas' person's mom. Okay.
I did the same thing. I didn't have it when I started here. They started training me the day that I started the course, so it was a lot. I get it. And I didn't have to visit it. It took me 2 semesters. I did 2 courses at a time. They wouldn't let me do all 4 at once, so I did like 1 and 2, and then yeah. For all of it.
So all the action is gonna be in the center of the pupil, because you want to stay away from the iris and the capsular's edge. So we're gonna bring everything toward the center.
Absolutely. I was gonna send. Are you sure?
You guys are gonna take over? Yeah,
I'm going about there, but he's gone.
Okay. I was gonna say I was gonna send them, but that's okay.
Can you give me the scissors for a second?
Are you good? Okay.
is bent.
So
The angle of it is not appropriate.
Yeah, you know what I'm saying.
right?
The angle was too acute. It gets hit in the cleaning and moving, and so wasn't it was
Doesn't take
much as now, so you can. It wasn't going in, yeah,
And very expensive.
yeah.
Oh yeah. How much would those?
How much?
Yeah,
800?
it'll
The
be.
little metal thing?
You know, this little thing, maybe a 300 or something. It's
Yeah.
yeah,
So you gotta be.
extra
before they
careful.
let you work in here, you have to be a little bit good at handling delicate moves.
Yeah.
Otherwise, you're a bull in a china shop. Like if you bend these, that's probably 1,200 to fix that.
So how much are the
Each instrument is
Yeah, quite expensive.
$100 for each
Yeah.
instrument. Probably not these,
Yeah, that's
but
what- everything
everything else is expensive.
Yeah, and it doesn't take much to damage
and
it.
there's only so many here. So if you have somebody that comes in and bends this every case, by the time you're through your first 10 cases, you don't have any more. So he's gonna have to cancel his list because he's got no instruments left.
See what I do? I fix them. I
So he's
I
good at
fixing. I fix
stuff
them all.
instead of sending it out to be
Yeah, I
repaired.
save them so much money and
Not
effort.
everything can be fixed.
You're
Yeah.
saving that much money?
Oh yeah, it's because it's I fix them. My colleagues used to send the instrument out,
0.8.
but the staff will keep it for me for when I come, and I fix it for them and send it back again. It's just
Sounds like you're an orthopedic surgeon.
Oh, they don't fix anything.
Yeah, it's just- yeah.
They break things.
Yeah. There we go.
yeah.
They break the most, those guys.
Yeah.
And look at you like it was your fault that it broke.
Yeah.
Ortho.
Sounds like a lot of personal experience.
Yeah.
I
I've been around. I've worked with them all.
I hate
Or
waste.
even we
I
used
hate
to-
wastage.
We used to do vascular here. We used to do like open urology here, like prostatectomy, radical prostatectomy
Yeah.
and stuff. We used to do a lot here.
There's no more of that here anymore. There's no vascular here.
No.
Oh. So where do you go? Do you have to
Ottawa. Yeah. Some specialties are centralized
We
now.
used to do femtop bypasses. We used
Yeah.
to do pneumonectomies. We used to do a lot of things here. But anyway, whether we should have, things, I don't know.
Like I'll never see again in my lifetime unless I go to a big center.
Yeah.
I remember I was on orientation and we've done a section, patients in neuro recovery, and was leading him to go back to the OR. She's 26, who was her lady who did the history.
Yeah.
And I remember watching Amy and thinking, oh my God, I'm never going to be able to do this.
And now you can.
Not with as much finesse as she or you.
She's quick.
But I can.
Yeah.
Yeah. Like we were in the ER yesterday. There's a potential case of neck flash.
Oh.
And like we're just so used to like paging the plastics and everything.
Yeah. Yep. No
Like,
plastics
nothing
here.
here.
No, it's
We
most.
used to
It's
have
most.
plastics here.
Use the plastics.
We used to do like a lot of hand injury stuff
Yeah.
here.
Like
He was-
nerves and stuff.
He was an expert at hands.
Would
The
he have
plastics
done
that
a
was
neck
here. He would have done a neck crash probably,
See, I don't even,
depending on who it was.
I only ever met him one time.
He was.
Oh,
like,
done.
He used to Ridgewood.
Un petit peu de pression maintenant. Normal, c'est le gelé. Ok, c'est normal comme ça. C'est normal, oui. Un petit peu de pression. Parth, any questions?
What's your favorite procedure?
Eye injections easiest.
Eye injections are the easiest.
Eye injections, yes.
The easiest one's bigger?
Yeah, we treat retinopathy, a lot of retinopathy with eye injections.
Yeah.
Regarde la lumière, tout le temps, regarde la lumière. So it helped a lot of people, diabetics, macular degeneration, vein occlusions. There was a lot of patients that needs that. And I do it a little different than other people. It's very painless. It's very, very effective and does a good job actually. So I do a lot of these at the office.
Yeah, you can do that one at your
That's I do those at the beginning. Yeah.
Which pen?
Of course, the second one is the cataracts, of course. Cataracts, yeah.
How much would a procedure like this charge for?
This is, I think, almost 400.
400?
Yeah,
Per eye?
approximate price, yes, yeah, approximately. You get discounted 15% on the second one.
Okay.
A little less than 400, just a little bit less, yeah. Hydrosection. There you go. Thank you. Okay. That's fini. Yeah. Ok, un petit peu de pression maintenant, c'est normal, c'est le gelé, ok? C'est normal, oui. C'est le gelé.
Oh, even if you come in, like once we start one, you can take your time and set up the other one and then whatever works.
We're in Egypt or something?
Cairo.
Yeah. Visiting Cairo next year, actually.
You are?
Yeah, that was next on my bucket list.
Oh, that's good.
Kilimanjaro this summer.
Oh my God, okay, that's good. That's
We're in Cairo next year.
yeah. How long are you staying in Egypt?
No, I'm saying next summer we're gonna look at it.
Okay.
This year we wanted to do kind of Africa.
Yeah,
So we're
okay.
doing Zanzibar, Tanzania.
Yeah, that's a beautiful place. Yeah. I've been to Kenya before, so
We went to Kenya before?
Kenya, it's
Yeah.
beautiful.
With
The,
whole,
the,
like,
the
boa
game
stuff.
drives on. Yeah, it's not in this area, but it's probably gonna freak you out. And I think Canada's putting restriction on travel
Yeah.
there.
Okay, check my
Yeah, yeah. But Egypt is not affected by this stuff. So. Which one? There you go.
I don't think it's done.
Oh,
Not done.
so it's not done? Oh, okay. I'm rushing it.
You're rushing, for sure. I didn't know you were Egyptian, I'd say you're Russian.
Hey, nice one.
One full of
Uh-huh.
all the big ones.
When she coming back?
Sunday.
Come home with you and mowed lawn.
Yeah, well, it's funny because Gloria's been going over to check the house,
Yeah.
and I've been doing the pool and the lawn. So Gloria, when she goes, she'll take a picture of the lawn and send it to Debbie. So she's messaged me a couple times and said, "Oh my God, you didn't need to do the lawn." And I'm like, "It's May. You have to do the lawn.
Neighbors will
You'll
complain.
come home and have to have hay baled."
Well, Phil did the lawn last week, and what they need to be done already.
0.3.
What made you want to come to Canada from Egypt?
Oh, it's a long story. I did fellowship in Michigan.
On Michigan.
So crossed from there to Windsor,
Uh-huh.
and then stayed. Yeah,
Oh,
so,
they just stayed.
yeah. That was the turn of the century.
Ah.
The next one is through Olsen Landed and through the people.
The next one is folding lenses. The next one is non-folding.
Which school in Michigan did you do your fellowship?
Uh,
Or did you do
it-
it, in
it-
the hospital there?
it's a Beaumont Hospital
Beaumont.
in Royal Oak.
Right.
That's,
Yeah, I was working in Wayne State for a little bit.
yeah.
You think I'm coming back from
Yeah,
lunch?
we're affiliated with the Wayne State.
Say it again.
We are affiliated with
Yeah.
Auckland University and Wayne State.
I think I scared
So
Kathy.
we have staff works here or there. So.
Yeah, no, Wayne State,
Yeah, great.
it's pretty cool.
Yes.
They have,
Yeah.
they have some nice technology.
And she was
Yeah,
like,
they are.
Oh,
Robotic surgeries. And
Yeah.
usually I don't.
Yeah, see, this was in 1999, and at that time they have a robotic surgery department.
In 1980.
Yeah,
What?
yeah, in
I thought that was
Beaumont.
in
Yeah.
2010s.
No. So at that time was starting. They were already established then.
No way.
No,
Yeah.
here. I said I took rape this morning, so I wouldn't say something rude. No. Nope. Maybe it was too. Like maybe there was several. But I think like. You know what I mean? Yeah.
Okay. Okay. Can look at the lights. Best thing to do today. This is some extra freezing that's gonna bite. That's the one. Pressure. So, Parth, any questions?
I still didn't understand that step that you just did.
The mark.
Yeah.
So the mark is the size of the rexus. So the opening, I go along that.
To make this.
This incision is marked with that. This faint mark on the cornea. I can see it. You can see it. Yeah. So I'll go same size. It doesn't have exactly same location, but same size. Okay. So you end up with a rexus that's centralized, and the size would cover the optic of the lens. It's not an essential part for me. It's an essential because of OCD, right? But some other centers don't use it.
Right.
They just eyeball it, which is wrong because if your cornea is too big, you're going to result with a big opening, and if it's too small for cornea, it's going to be too small rexus. So. And each one of them has its own problems, so I think it's best is to measure it rather than just eyeball it.
Have you ever had like a complicated case?
Of course, yeah.
What would make it complicated?
So the PC tear is the posterior capsule tear. Okay, this opens it, so you end up with no support for the lens. Then you have vitreous coming through the opening, coming to the front, so you can see a lot of deviations from the normal. So because of that complication, a lot of the stuff I do is to avoid that complication. So using the J-cannula, this kind of stuff is all to avoid that complication.
What would you do in that case?
So it's if the vitreous came out, you have to remove it. We use what's called vitrectomy. So you'd see the vitreous, you have to stain it with triamcinolone. So you use that triamcinolone-assisted vitrectomy. And you have to modify how you implant the lens. So sometimes you need three-piece lens. This is called one-piece lens. The other one is called three-piece lens because you can implant it in the sulcus. And when you have appropriate rexus size, you can actually tuck it in and get it to capture in the rexus itself. So that's why it's a good backup if you have a good centralized normal size rexus. It saves you when you need it. Yeah. So prevention is better than cure. You can have to start to make every effort to avoid that complication. And one of it is to avoid irrigation aspiration without the lens in there. J-cannula replace that for me. Because the capsule is very, very, very thin, so any capture of it, you can open it. So you have to be very, very gentle with it.
Right.
So 0.5 that was.
0.5 EFX, feeling good. Alright.
Okay, thank you. So now I can do IA without having fear because I'm using this as a shield. It's protecting the capsule from my tip. Okay, so I'm moving it, and I move it around to do that. So for example, I want to go there, I will take it with me. Okay, so it's always protecting the capsule. Capsule is king.
What's the point of measuring it, just to open it up, or are you trying to get rid of more?
You're washing out all the viscoelastic and any remaining cortical material, cataract cells, and so remove them that way. So this is the idea. Because if you leave the viscoelastic in, it can increase the pressure.
Right.
And if you leave cortical material in, it can cause inflammation. So both of them are a problem. So
Yes.
Or one of the.
J-cannula
Yeah.
on the bigger syringe.
Have you ever needed robotic surgery for cataract?
no, I used to do femto laser, which is a laser procedure for cataract. But I didn't feel it makes a lot of difference in the outcome, so I stopped doing it. I did it for 10 years or so.
Yeah, I see something in the States, this vascular.
Okay, my friend, just keep looking at the light. Let's get started here. Parth,
Yep.
are you ready to give me the steps?
I'll tell you steps.
Yeah, go ahead.
I am. No, I'm doing it right now.
Uh-huh.
Yeah, first liquid goes
So incision, then
in, then this, and the freezing.
that's the freezing. That's the xylocaine 1%. Uh-huh.
Then this is like the thing that goes
Yeah.
send it on top of the.
It's yeah. It's called endocoat. Uh-huh.
Sorry, what?
Endocoat.
Endocoat.
Yeah, endocoat. Uh-huh.
And then you do incision on the side,
Yeah. Paracentesis.
so then it goes inside as well.
Yeah.
You okay over there, buddy? Yeah. Okay. Good, buddy. This yellow thing.
Okay.
And then you have to,
Yeah.
yeah,
Yeah.
to
Yeah.
get the
Rexes. Yeah. Huh. That's good. Good job. Uh-huh.
then
Yeah.
circular.
So then, yeah. That's capsule called capsular rexes. Yeah. Huh. Uh-huh.
And then you like swirl it around.
Yeah. So this is what you call hydrosection. So this section. So I go in underneath the capsule and lift up, and then inject.
Oh, this. Right.
Yeah. So we'll go this. And,
Tarek, when you get a
so splitting the layers, so I can move it around without risking the capsule. So, and then I rotate, and then I split the nucleus from the epinucleus. So they have three components: nucleus, epinucleus, and cortex. And then the capsule itself.
And then you chop.
Yeah. So chopping. Okay. So put this here. You remember? We'll just put this here. So
oh, there's that.
yeah. So that's it helps.
Might, hopefully the thing is okay. I think it's.
If done, okay, we'll see. Okay. See, this is going around this area, but that's okay.
Oh, it's under there.
That's okay. That's fine. Okay.
Oh, I didn't have a phone. Oh, yeah.
You drag it between the middle.
Do you need help with that, Katrina?
Yeah,
Just leave it for me. Just put it in, and I'll fold it under the. That's good because I'm going to show part how to.
You want me to put the heel on?
Put the heel, but not a lot. Just a little bit of heel on. And just put the lens on top and keep it in the cartilage. Don't take it away from the carpet.
Yeah, I'm not gonna touch it.
Yeah.
I'm gonna watch this one.
Yeah. Okay.
EFX 0.9.
Yeah, so this is J-cannula cortical cleanup.
Huh?
Okay.
0.9.
Okay. Yeah, exactly. Uh-huh. Small little piece of. Look at the light, my friend. Look at the light. There you go. See, I'm going to use the J-cannula to actually take this out. See what I did here? I took the piece out with the J-cannula. Okay. Pardon? This is another viscoelastic material. It's called Helon, this one. So this fills the chamber. This is the one that looks like spaghetti. Okay. Yes, yeah. So McPherson. And McPherson, the other forceps. And the lens is...
I didn't
okay.
open it.
Yeah, okay.
I watched.
So
Just gotten caught up here, Nick, and there'll be a little more available. You know what I'm saying, Doc?
okay, so let's do it here. So if you look here, so it can come in. There's an edge here. Underneath here is an edge. You see it? Forceps underneath. There we go. So this is where the edge of the lens has to go. Avoid touching the optic. I don't want you to touch the optic. Okay. So actually, it's so flipped. Okay, so it should be this way. So it has a direction, so it has to be going this way. Okay, and see that haptic can get captured in the front. The back haptic can be captured in the back. So I'm going to take this off here, and I'm going to start folding, and I make sure that this is underneath the edge. Okay, and I'm folding, so nothing is captured between the wings when I close them. Okay. So and I'll put it in. It has to go easy here. If it didn't go easy, it means it's captured. I check both haptics are there.
You know, right now with the McPherson.
Yep. So front haptic is there, back haptic is there. And this looks good.
All my papers It's gonna save me so much time later, yeah. I just find it, for me, I find that's way easier.
Okay, now we're using the lens as a shield, shredding the capsule.
If there's an expired lens, maybe I can practice.
You need the unfolder?
I already have it.
Oh, I didn't know.
Not yet. So we're gonna irrigate, clean up more, and clean up behind the lens. See this material here? I'm gonna clean it up. With irrigation, no aspiration, just irrigation, and let the fluid dynamics do the job and clean it up. Can you look at the light? There you go. Now I'm centering the lens to be covered completely by the rexes all around.
Do I owe you any eye drops here, Dr. Youssef?
You always have to put the prednisone and the Cocosopt here.
Okay, I didn't do that yet.
Okay, so you can just put one per patient. One each per patient. You can open the...
You want me to do it at the end?
No, now's a good time.
That's a good time?
Yeah, you just put it in. Just put it in this package. If she didn't.
Yeah, there's some in here. Heather must have did the first time.
Okay. No, it's just one per patient, not per eye.
Okay.
And oh, done. Both eyes going great. Yeah, there you go.
Got a lens for you to look at. Do you have a second, Dr. Youssef?
Oh yeah, sure, yes. Okay, so this is right eye, so it's 22.0, DI blue 22.0, DI blue 29, expiry 12, and 527. That's good, thank you.
20 DI group, 2029. Okay?
And look at the light. I'm going to give you some extra freezing here. It bites a little bit that one, just bear with me. Here it comes.
Yeah, but let me double check it, because now I'm questioning it. I think I said 2029.
2029, yeah.
2029.
And look at the light.
Yeah, of course.
peel before I should do
Oh, that's a lot of practice. Rex is one of the most critical steps of CAC surgery. It's you practice on something like you can use a plastic bag actually to plug. You can use that, and you can use tomato peel.
Yeah.
So you can
Oh,
put it to
tomato
tomato peel, yeah. So you can use that. You can practice on those, and then you can practice on pig's eyes.
Right.
So and then you assist in that step with somebody else, and because they're very critical, and you have to understand the mechanics of it, because there's a mechanical part that how to pull, where to pull, and which direction,
Can you
and
move that table a little bit
how to
for me?
save it from if you start to misdirect.
Far away.
Oh, just move it closer to you.
Closer to you.
That's good. Thank you.
Hey Jen, it's Brendan. For that previous cataract patient, we just did it with Foley. I didn't fill out his implant cards. I put like a sticker on it, but I didn't put his name and stuff on it. I can, if you put them to the side, I can run out quickly and do it. Okay. Yeah, Dr. Youssef, the last one for the implants. I didn't put the left on the right. It was the same implant. Does it matter?
Serial number matters, yeah.
The serial number
Matters,
matters?
yeah.
Okay.
So,
I'll put another number.
yeah.
Okay.
Yeah, there's each one is identified by a serial number, and if something happened with a recall or something like that, you need to have the accurate one. You can see the pupil is floppy. You can see what's happening, and this is the floppy iris. So this is, you stay away from that iris, because it's what you call magnetic iris syndrome. Magnetic iris syndrome. You touch it once, and it's just gonna
I'm gonna go to
jump
the
at
side.
you after. So,
Dr. Youssef,
see it.
I'll go to the next
Yeah, go ahead, yeah.
I just gotta run the day surgery quickly, Katrina. No, I gotta fix the sticker. Oh, missing the last one here. Can you just, it's a Phaco time comes up, can you just get it? What? It's not, it might not be done yet. It might not be done yet, you know what I mean? Yeah. Oh, it's done. It's done.
Is that?
1.4?
Thank you.
I'll be right back. Thanks for the help, Dr. Youssef.
You are most welcome.
Will you be back there now? Oh, the IA beside the...
Yeah, but this doesn't have a tip.
Oh, there's no tip.
Okay, I'm coming.
There.
The tip is there? You found it?
Look at the light, my friend here. Oh God, that's good.
We're back in business. Yeah, man, no problem. Anytime. You got 2 blades there, eh, Katrina?
Yes.
Great.
The opening.
Lovely.
Opening.
And we're all done for this one.
Dr. Youssef will have a big sign out.
Look down a little. There you go. That's good. Perfect. Just keep looking at the light. Remember, your only job is to look at the light, huh? So this he has IFS, so I'll make the wound a little bit longer. Look at the light. Try your best. I know it's bright. Just bear with me. Thanks, Katrina. Great job.
Sorry about that.
Great job.
I'll get better someday.
He did great, so don't worry about it.
If you want to get better, stick around.
I sure
Yeah.
can.
I'll go back to
Look at the light, my friend.
He actually had
You want me to
time
do my
stretch.
best job, you have to look at the light.
Yeah, he had time to stretch. That's how slow I was.
Please. Now he's all limber, he's going to speed up. That's not good.
Yeah, it was a good stretch.
Because you were back when
Look at the light, down a little, down, down, down. There you go.
I think he used this one.
Okay, thank you. See, these rexes are not touching, right? They're overbiting, so I'm gonna fix it.
I found it.
And I'm surprised you can't see, like, I found my
And you fix it, they test it right away. So yeah.
like underneath the
Oh, yes,
I couldn't see it at all.
My colleague used to see this and just put it away to be fixed.
You're not worried, but it's not.
And he's putting it
No,
on
no,
top of
so it's very strong.
Yeah.
Are you,
There you go. All fixed.
Can I show you this left lens, Doctor?
Okay.
Yeah, you can, but just wait a minute.
Scooching by here.
Sorry.
No problem.
I'm glad you came back home.
Gonna have to wait a minute. Just give me a sec.
Better judgment, but here I am.
I'm sure you got back. Or you got back to Dr. Youssef. Whatever that is. Alright guys, see you guys later.
Ciao for now.
For now.
Thank you. Okay, show me the lens. Okay. You know that's the left side. Left side is 22.0, DRB 22.0, DRB 29, expiry 12 and 525. Thank you. Keep your hands down.
Yeah, I got a left eye.
Look at the light. Look down a little bit to the light. Yeah, there you go.
Expiry date on this is 2029. Thanks, Katrina.
Yeah.
You're the best.
I'll come play later.
Yeah. Yeah.
Now, the Lester
this is yours?
is in very bad shape.
Okay.
If you want to look at it after.
Yeah, I can do that. Yeah. Remember, he has IFS, so stay close to the center, away from the iris. If you touch the iris, it'll become very floppy and. Look at the light. Look at the light. There you go.
2.1?
2.1.
Thanks, man.
Look at the light. All right.
I look at the vitals and I
Look at the light.
any weird medications, the NPO, if they have a ride home.
Need it. Oh, done. Okay, there we go.
Hey, what does that look like to you? Tacky, or does it look like
I'll
you
give
could-
you
do you see any
a little
peace?
bit of pressure. This is the freezing, my dear. It bites.
Did you see peace? Yeah. Or no? There's no peace. No. It's a good. So,
Look at the light. Huh?
can you check your chart?
Can you look at the light, my dear? Okay, there you go. That's the best thing to do today. For me to do my best job. Yeah, I know you're not. So now you are.
So there's a good chance
Yeah, there you go.
positive. Okay. Yeah, no blood, no. There you go. So you can just tell Dr. Youssef, no AFib, still an AFib. You'll say
Okay.
that's great.
That's good.
There you go.
That's good. What's the heart rate?
92 now.
Okay. Yeah. So that's good. Thank you.
Easy as that, Nick. Yeah. Thank you, bud. You're welcome.
Continuous
better watch out if he starts throwing that rock.
No idea.
Look at the light.
1.8 that was.
To the left, thank you.
Okay. Told me Lester was bad?
The last one, this
Yeah.
one's not much better.
Yeah, okay.
They're all bad.
So, don't use them much, but okay, all done.
You can, if you want to, yeah. Say, yeah, in the anesthesia area.
Some extra freezing. This will bite a little.
Come over there just a sec, right? Yeah.
You're doing great, my dear. Oh, the accident is good. Everything's going well, so relax. You're doing fine. Yeah, try not to move. Can call.
Staying still this far.
Yeah, but just it's pays back because if you move too much and get a complication, you're gonna have to stay much longer,
Yeah.
right? So be smart.
Yeah, just remember he's got instruments in your eye, and you don't want
Yeah.
to move and
Yeah.
have those instruments do damage that they're not
Yeah,
meant to do.
yeah, yeah.
Actions.
Like sometimes it's better for them to be not sedated.
Yeah.
You can reason with them
Yeah.
and
Yeah.
say,
Yeah.
if you move, this is what's going to happen. Where if they're sedated, they don't know that they're moving. They have no idea. And sometimes they'll nod off, and then they pick up like this because they forgot where they were, and then you do damage because you've got sharp things in there that they shouldn't be moving when you got sharp things in your eye.
Is it ever performed under sedation?
Yeah.
We do GAs periodically, you know,
I have.
like Down's patients or
Oh, I see.
that
So
sort
not
of thing, or
combined.
for whatever reason, they
Yeah.
might need a GA, but not very often because you see how fast it is.
That's
Like,
what I mean.
like if it's a GA,
Adds a lot of time.
it adds like 20 minutes, 30 minutes
Yeah.
to
And
a
then
case.
there isn't routine
Depending on-
anesthetists in here either,
Yeah.
right? So
Yeah.
then they have to find additional
Yeah.
staffing.
Last,
1.7 Brendo is my time.
1.7.
it has been almost 5 or 6 years since it's had the anesthetist here. Yeah.
And they used to do, like when I started, they were doing retrobulbar blocks. So that the block took a long time
Yeah.
itself to do. And we were doing like 4 in the morning, between 8 and 12. We were doing 4 cataracts. That was it.
That's it?
That was it. And they were all extra cap. They'd take like a little looped curette and scoop the cataract out and then suture the hole. And the lenses then were
suture.
they would suture because the lenses weren't foldable, so you had to make a larger incision to put the lens
hole, I think.
to put the lens in. You put it in solid like this, but then you had to suture the hole.
Oh, wow.
So they get 2 or 3 stitches every case. So like the techniques changed a lot in my career.
Yeah.
And actually, Phaco was just coming in. I think I had the first Phaco machine that we ever
Yeah.
had here.
Yeah. The Ortley
Was on my watch.
was the Ortley at that time.
No,
Ortley?
Ortley was at the General with Dr. Taylor. We had a what's Rob Hickson?
Alcon.
We had Alcon.
Alcon. Yeah.
That was our first one we had. Yeah, we always had Alcon here, and at the General, Taylor had the Ortley because that was his deal.
Yeah.
And everybody hated it.
Yeah.
Everybody hated it. The Ortley Phaco.
Clean eye on this one, Mike.
Okay. So. Okay, my friend, just keep looking at the light. A bit of pressure. This is the freezing, which is gonna bite a little bit, that one. I think the playlist finished. Parth, can you press on the? There's an iPad on the side there, on the side of the microscope. Yeah. That's okay. That's okay. That's fine. Some songs are a little lower volume than others, but that's good. Thank you. That's fine. It's okay. So, otherwise, the other songs will be too loud. So,
You don't want the nurses to start singing.
yeah, dancing and
Bad song.
I had one patient was dancing actually, so she was shaking
Tapping her
completely.
toes.
Yeah. Yes. So,
Get Naomi in here. It's game.
Your game over.
uh-huh.
You good?
Yep. Thank you. Pardon? Non-AFib? Okay.
You have some stickers for me, Nick? Yes, I have one here. Okay, I'll take it.
Does AFib change your approach?
No, it doesn't. But if it's a not known AFib, so I'll investigate it. I'll send him to do an EKG and consult internal medicine. Because sometimes this is what happens. You catch these kind of things.
Yeah, it's like an incident.
0.5.
Yeah, it's a finding, but it's can save somebody's life that way.
Right, yeah.
So,
But if it's known, we don't have to worry about it.
So this is the fellow that asked if it was related to Parkinson's.
you can ask him. He might know.
Yeah.
I'm running out of people to ask.
Yeah.
Antibiotics coming up. Got a lot of folded, coming up here. It's nice.
That's good.
Yeah. Katrina and Sunshine had a good time for you. I'm gonna need more full stop. I'm gonna get more credit than 0.5. Hey, start from the OR calling. I'm gonna need some more prednisone 0.5 for the eyes and some post-ops. We're almost out. Yeah, 0.5.
Okay, all done.
Just make it big though. You okay?
Yep.
What was he pre? 58. Okay, yeah, couple deep breaths there, will be okay?
Some extra freezing. This is gonna bite a little. That's the one. You can look at the light. That's the best thing to do today. Look at the light. There you go. Bless you. Partly notice the fan here.
Oh,
The fan, yeah.
Oh, yeah. Oh. Got everything in this.
So it's avoid. You get hot sometimes, and when you sweat, you fog the microscope, so you don't see. So you have to take control because sometimes the air condition is not adjusted very well. Sometimes too cold, sometimes too warm.
Freezing in here. I don't know why you need
When you're dressed in the gown and stuff like that, it's more. Yeah, if you're cold, you can get you something. Get you a warm blanket if you want.
I found it warm in here this morning, but it's just nice now.
I have my own control. You can say I'm a control freak. Huh?
Is the yellow sclera?
This is what you call pinguicula.
Sorry, what's it?
Pinguicula. So it's a degenerative condition that happens from exposure to sun and environment. Happens a lot in fishermen, farmers, and somebody that's exposed to the outside a lot. So it gets much more than that.
Is it pathologic or is it just
It's a pathologic. It's not normal, but it's very common, very very common. So pinguicula, but we don't treat it because it comes back if you try to treat it. There's no reason to treat it. Sometimes it gets inflamed and you have to treat it with some steroids. Rarely you need to remove it. in contrast to what's called pterygium. Pterygium, when it has that kind of degeneration, but it invades the cornea. So it starts to get into the cornea, and it can blur the vision because it can change the curvature of the cornea, so it causes astigmatism. So this need to be removed. Same reason. Same exposure to the environment and sun, and especially if people that don't wear sunglasses. I think wear sunglasses is very important.
0.4?
Yep.
Yeah. Didn't prepare this one.
Did I not?
Yeah, no.
Oh, sorry, I thought I had.
Let me see if I can pass it.
I really thought I had.
No.
Yay?
Yeah, we're good. Yes, I got it. Twice in a day.
I know. I'm just. Happy.
Where's your mind?
I think you need to send me home.
That's a solution.
That's punishment enough for me. I'm trying.
Oh, I love it.
I think I should be expelled.
You wish. You're staying.
Yeah.
You're not going anywhere.
Like an ophthalmology queen.
No. The queen has had her day, and it's not today.
You can't take that crown from Debbie.
Yeah.
Oh my gosh. Well, Debbie's the
I trained Debbie.
You did, eh? Okay, well maybe you can.
I trained Angie, trained Debbie.
Oh my god.
Had a hand in training Manick and Jim.
You're gonna age yourself, Money.
Eh?
You're gonna age yourself.
Well, I'm younger than all of them, but I was here before they. They all worked on the floor. And
Before.
then came here
Yeah.
after.
Yeah.
You started like straight to Aurora, Bonnie?
2 years after I graduated.
Oh.
But I worked everywhere. I worked emerge, I worked peds, I worked surgery, medicine for those 2 years, and that was.
That was good, actually.
That was in the days when the union didn't really do much. You did short swings every day and picked up all the extra shifts you could to gain experience.
Yeah. I think it's a good thing to rotate it.
What rotation was your favorite?
Here.
Here? Oh, are you just saying that, or do you actually?
No, it's here. It's here. I'm not.
Look at the light. There we go.
You're so welcome. You're so welcome.
A bit of pressure. Can you give me some extra freezing, my dear? You're gonna bite a little bit. That. Look at the light. Look at the light. He's gonna bite a little bit that one. See, started to dilate more. See, because of the xylocaine and phenyl 10 in this mix, and now dilated more and more. Now we're safe. So see, because the people was how small, now it's how big. That's good. So that's safe to do surgery that way.
Nothing local? Getting stingy on that. Yeah, I don't.
Look at the light, Mayor. Look at the light. All right.
Went over to see Debbie's sister, Gloria, last night.
Okay.
Had a couple days apart.
Euchre or
Cribbage.
I saw the cribbage.
You saw this thing, Cribbage?
I saw the big cribbage. I'm interested. We gotta get Katrina there for the euchre night.
I know.
I will go.
And my problem is
That's true. You are. You're in demand. That's good.
It's good, but it's not good for you.
That's right.
Look at the light, my dear. The best thing to do is to look at the light.
I thought of it.
Maybe you mentioned it.
At this point, I use my head. Yes. Program to receive.
No, we don't have residents here. No.
Here? Oh, so you
Yeah.
don't go like other academics?
No. Yeah, I wish I have. I like to teach, but that's
No, it seems like you really
Yeah.
enjoy teaching. So.
yeah. So that's what my replacement to that is the YouTube.
Is it YouTube?
Yeah, YouTube is you reach much more audience and
I'll push it if I need to.
Yeah, I appreciate
my YouTube channel has been 20 years now.
it. 20 years.
20 years.
YouTube channel?
But
you still-
ancient.
Ancient. Wait, has it been around for 20 years?
More, yeah. Once it started, when I heard about it, okay, that's the way to go.
Yeah, I think the first video came out in like 2004.
Yeah.
So you were like one of the first creators.
Yeah. So.
The larger number there? See, good. 2.9. We had a 1.7 and a 1.8 earlier. 2.1, 2.6. That's the highest number of the day so far.
I do a lot of unedited videos on it, so first I want people to see what actually is, and the second thing is we don't have time to edit, so just put them on and
She's still signed.
people see because sometimes you see a very clean, nice video, but it doesn't show you the trouble you pass through to before you clean it. Yeah.
Check the red sticker, move it. I bet it's in the wrong spot. A lot of the times it.
This is the lens going in, my dear. Almost done, by the way. Okay, you're doing great.
Yeah, so like I was saying, like if they put a lot of the times, just because they're already in most surgery, they'll put the red sticker like in the middle of the chest. You just gotta move it over to the left. And we'll see if it'll change it, but yeah, I mean that's not sinus if that's what it is. Yeah. And there's no distinguishable features there. Is she known for AFib or anything? No? Is there a previous ECG?
Oxyhydration. So all this whitening will go away in a few minutes, actually.
A few minutes.
Yeah.
Go to results review. There's nothing. see, move the sticker, see if it changes it. If it doesn't, you can call Dr. Youssef and he do the say post-op ECG and then we'll go from there, okay?
Well, you want a break?
Sure.
Okay. I kind of just scrubbed it.
I just heard
Yeah,
that.
you didn't even give her a chance.
I know.
Choice. Oh my gosh.
I mean, I could come back, but she
You're
really
awful
didn't want to
awesome.
go.
She signed us out. Brenda. Brenda Lee.
But it's still like,
Thank you, Jen. It could just be too, like, with the, it's dummies, it's tough sometimes.
A bit of pressure.
oh yeah.
Yeah, you have to do an ECG, yeah. Yeah.
Oh, okay.
Well, actually, I'm pretty good with like blocks and graphic stuff.
Yeah.
But whenever it's a lot of art.
That's something that I never learned was ECGs. I would love to do a course on them.
It's good. I really enjoy doing them, to
Yeah.
be honest with you. One of my preferred nursing skills. But I also do sedation a lot, right? So I get to see them pretty often. Do you want some help?
I know I'd like to see when I was
You want more than that?
Isn't it one? Or is it half? I haven't been using it anymore.
Alright, come here.
How you doing, buddy?
What is this?
I want that. Thank you.
Cookie?
Bart, any questions?
Yo.
Uh-huh.
I have faith in that.
Yeah, okay. Nice.
So I'm gonna make-
I'll just finish this.
Yeah.
Oh, is that okay with you?
Yeah, because I was.
These are both garbages, by the way.
Huh?
If you care.
What is
This is a garbage and that's a garbage.
Oh.
Because I don't like using garbages
that?
till the end of the day. You know what I'm saying?
Almost got it.
So we're on the second line. This is
Oh, do you remember Connor earlier this week?
Hmm?
Do you remember Connor from earlier this week?
Yeah, okay.
Connor and Zane?
Yes, yes, yeah.
Yeah, yeah. Like all four of them said they were just gonna rush into this OR today.
Okay. Yeah. So, yes. Yeah. Where are they?
I don't know. They all took my location last night. They said we're gonna come find me.
Okay.
One, like, come see.
I text them or something because we're almost done today. So,
I think their surgeons are like keeping them though.
yeah.
3 of them are in ortho.
Yeah. Okay.
any other implants.
They keep them there already.
Okay.
If not, like he said, he really did.
Right? With
Yeah,
the,
okay.
official.
Yeah.
Is there anything else you need that I can do for you right now? You happy? Okay, jump right after it. Thanks, Katrina. Thanks, Amber. See you tomorrow. Bye.
Ah, you're funny.
Look at the light. There you go. there's surgical simulation nowadays. You asked me how to train on this thing. There's surgical simulation that feels like an actual thing. It's not exactly like this actual thing, but close enough. So for you to learn the
Which surgical simulation?
for cataracts and tools you actually see and simulation give you a feedback and tactical, yeah. So in residency programs they have that.
VR thing, or is it like
It's an actual and VR in it, yes, exactly, yeah. But you look it through a microscope. Yeah. Oh, done. Oh, you did great.
I do 23.029 for the right.
Try not to move.
What is that?
So we started the surgery already. This is the step of the surgery.
Oh, dear
So we
God.
started already. I need the logo. Oh,
Sorry. Katrina's distracted.
yeah. Stop, Katrina.
Sorry.
A bit of pressure. This is gonna feel a bit of a bite. Don't move. You're doing well. So moving is gonna cause some issues, and prolong the surgery. Should take 5 minutes. Okay, so just bear with me. Even if you feel something, just relax and you're just doing well. I'll walk you through what I'm doing here. So, do you want to know what I'm doing?
Yeah.
Okay, so I'm filling the eye from inside with some thick material to fill the chamber and protect the cornea. And I'm covering the cornea with that same material so that it doesn't dry out. So now I'm opening a small second incision, a very small one, for the second instrument. There you go. You're doing great. Everything's going well. Putting a mark on the cornea so I know where to cut and start the surgery. And now I'm opening the front of the cataract to allow me to get into the inside of a cataract. So we open a small circle, about 5 millimeters. Look at the light meter. Look at the light. There you go. 5 millimeter size to cover the lens. The lens is about 6 millimeters, so this is 5 millimeters to cover it. So when I put the lens implant, it will cover that one. Now I'm going to split the layers of the cataract into multiple different layers. Okay, so I can remove them safely, leaving behind the capsule, which is going to hold the new lens. Doing really well, so everything is going really nice as planned. There you go. Perfect. Now I'm going to use an ultrasound to break up the cataract.
Am I supposed to open my eyes?
Your eyes are open already, so that's good.
Are they?
Yeah, yeah, it is, yeah. Yeah. So you don't have to worry about that part. That's good. So we're going to hear some buzzing noise. That's the ultrasound. There we go. That's perfect. So we divide it like a cake and remove it like a cake.
What does that do?
So it's breaking up the cataract. So because we don't remove it in one piece, we remove it in bits, little small
Did I
bits.
get
Yeah.
to take them home?
Unfortunately, no. We used to do that years ago. Yeah, it's powder in water, so there's nothing.
I could take them home.
You want to do that? It's nothing it's like a little turbid water. There's nothing much in it. Cataract is small.
Oh my.
Doing great.
It's a long day.
Yeah, almost there. Excellent. So, doing really well. So, no, don't move, don't move. Why are you doing this?
Hey,
You're gonna hurt yourself. Stay in the middle. It's very critical. If you move, you can result in a complication and pay for the rest of your life. Look at the light. Look at the light.
Oh my God.
Just try not to move, okay?
Yeah.
Excellent. So there you go.
The light sits up there.
Okay.
You're doing really well. You're doing really well.
1.6, Katrina?
And that's the lens going in now. I'm almost done, by the way. Almost done. This is the lens going in. Excellent.
I folded it perfectly.
Yeah, perfect folding. My God. That's the lens gone in, so they're doing great.
Oh, Debbie's in Italy right now, right?
Yeah, she'll be home Sunday.
I can't wait to hear all about her trip. I'm jealous. Have you heard from her at all?
A couple times. Yeah.
Is she's having a good time?
Yeah, I think she's having a good time. I think she'll be glad to get home though.
I know she
Like,
was worried
4
about
weeks
the
is a
length
long
of time she was
yeah.
gone.
But it's like
Almost
6
done.
hours, right? So probably
Almost
takes
done.
weeks to get
Okay.
onto
Almost
the
done.
Yeah,
There you
their
go.
time.
their time.
I'm closing it down. Look at the light. Look at the light.
Like, we're shift workers, it's fine, but it's
Ah,
It takes a lot out of you.
What was that?
it's the cannula ejected. You have to.
I always.
Yeah.
try
Give
to
me some more
keep your head
antibiotic.
down, okay? Can I get more antibiotic,
Keep your
please?
hand right
Yeah.
here.
More antibiotic.
Good. Okay. Huh? That's good. Almost done. And we're all done. That's it. One down, one to go. Good well.
You talking to me?
No, no. Talking to my camera. Look at the light. Look at the light. There we go, my dear. So that's great. So I'm going to start right now. I feel a bit of pressure. That's great. Excellent. So I'm going to give you some extra freezing. This we're going to bite a little bit. Just bear with me. Don't move. Okay. Here it comes. That's the one. That's the one. That's the one. Here. That's the one. Try not to move.
That burn.
I know. I just told you. It's freezing. Yeah.
Freezing
It's
over
freezing.
a bit,
Yeah.
and then
Yeah.
you won't feel it.
Yeah.
Okay, I
Yeah.
didn't know.
Yeah. So look at the light. There you go.
Like at the dentist, it
Yeah.
burns a little bit when they first put the freezing in,
Yeah.
but then you're frozen.
Oh my God.
You're doing great, my dears. You almost done. First one went well, really well.
Do I have to see him before I leave?
See me? No, you're gonna go to the office. Look at the light. Look at the light. There you go. No, I'm gonna drive you out and look at it there, and then you can go. And I'll see you probably. You're gonna go to the office. We'll do a checkup, and I'll see you next week again and next month.
So you have 3 tables, you're ready to go.
Mhm.
Just missing one more tray for the last one, but
Okay.
you said about 10 minutes.
Perfect. Should be good then.
On that note, I'm gonna shortcut this.
Yep. Mm-hmm. Okay, no problem. You should be able to go back in at the end. I think so, as long as you didn't DC the orders.
Doing really well. Excellent.
1.3.
So try not to move at all. I'm doing a critical step, so don't move, okay? Okay. Sometimes you feel pressure doing that, but just don't move, okay?
If you go, like, wait
Doing
for
really
it.
well. That's excellent.
See everybody. Yeah. There you go. Yeah. There you go. That's the first one, right? There you go. Okay?
Is there blood in my eye?
This no, there's no blood. No,
No?
no. This the lenses are going in now. So I'm almost done here. Doing great. Okay, that's excellent. And we're all done. Both eyes went great, my dear.
Yeah, just have it ready.
I can't hear anything today. Well, every day, but especially today.
Okay. Bit of pressure
Sorry,
here.
Brenda. That wasn't even intentional. I usually get you once or twice.
Yeah,
but
that's okay. You surprised me. It was a little refreshing. Here's your 28.
So we can
I didn't even need it.
That was funny.
let me see. Try that
Amy
first.
got me the other day. I was like, do you think I need to go to hospital? And she's like, stop.
You can open a Malayugan ring.
You want it open?
Yep.
Coming up.
So it's to dilate the pupil a bit more. The pupil is too small to do the too small to do safely. Lester too. That's beside it. Is it good, Lester?
Lester's there.
It's good.
It's seen better days.
Okay. Okay. So
I think you'll manage with it, but it's
So
definitely seen better days.
okay. So let's see here. So this you can see it's looped. So each loop capture part of the iris, dilates the pupil. No, that's not too bad. Okay, there you go. It's called Malayugan ring. So this will keep the pupil dilated during the surgery. And I have to add more viscoelastic. Okay, that's good. Now, because I have the ring inside, look at the light, my friend. Look at the light. The big light. There we go. That's the one. That's the one. Here we go. I didn't mark the cornea this time because it's already marked by that thing. Yeah. So it goes just 1 millimeter inside, and that's it.
Good music too.
Yes, I'm happy to hear that. That's great. So he's
It's an old one.
yes, I like a lot of those oldie stuff.
Yeah.
I don't like the new things. Yeah.
Two things I can't stand is rap
Oh,
and I'm sorry, but opera. Opera.
yeah. Agreed.
Got some mixed up droplets here.
Thank you. Appreciate it.
I owe you a gallon of wine. I don't know where it went. Oh, down here. It's all good.
I don't have any of those.
Don't have.
No, wait, no, I don't. .3 was your time.
1.3 for the left. Thank you. Tell you Kate's off till June 8th now. Kate's off till June 8th now.
From her concussion?
Yeah. She's having a hard time with like word recall and stuff right now. Yeah.
So let's take it out.
So at this point, Jake, we can just push the tables out because we don't need them anymore.
And we're all done for this one. One down, one to go. You did great. Look at the light. Look up, down. Look down. Here. No, the big light here. One just in front of you.
Oh, there.
Yeah. I'll show you this one here. There we go. So we make a little bit longer incision. Give you some extra freezing. This kind of bite. There you go.
So we're waiting for them to discharge him, so we're talking with one of the nurses, she's a newbie.
Okay.
Anyway, so he's asking her which part of Newfoundland she's from, and he's naming the towns that are around there.
They have the
Look at the
funniest
light.
names of towns.
Look at the light, huh? You can talk, but don't move your eye, okay?
I'm sorry?
Don't move your eyes when you talk.
Oh,
Okay.
okay.
Keep your eyes on the light.
Okay.
There you go. Otherwise, you're getting complications. So we don't want that.
I get him to the elevator, and he
That's
says,
good. Thank you.
"Are the airport bound?" And I said, "Yeah, you're taking a flight for sure."
Okay.
And he says, "Where did I come from? Why did I just say that?" I said, "I don't know, but you're making me laugh."
That's all right.
And I said, "That's why you can't drive till tomorrow."
That's it. That's it.
It makes me laugh. So up at his cottage.
You didn't do that.
I didn't do the size is just enough for the rexus. So the other one was a little bit more oval, and it was just below the size of the rexus, and that's my limit.
So he waves them in.
Look at the light, keep looking at the light, the big light. Here we go.
Like this happened, so we waves them in, and they come in and we get to chatting and whatever. And so the wife, I'm chatting with her. She's a nurse. She worked OB in Ottawa, and now she's a program coordinator or something at Russell Meadows and Hartford and Morrisburg.
Okay.
In long-term care. But she said she came to Winchester and did like an orientation on OB, and she said no, that wasn't for me at all. And I said, yeah, I said, I can't tell you the number of people I've heard say that. And so then I said, well, I was in Winchester for 15 years, and she said, really? She said, do you know Winchester? So this girl. Anyways, I said, yeah, she works in pharmacy, I know her well. Oh, she bought the cottage 2 doors down from where we are. So then guy turns and says, you do know everybody.
You do. You know lots of people.
Yeah.
Says something about your character, I think.
Well, anyway.
In my
But the longer you talk to somebody, the more common ground you find with them.
Of course.
You know what I mean?
Yeah.
But I laughed. So the one day we were up there and it was raining. In the morning we got up. So Guy's parents are buried in Petawawa. That's where they're from, is up there.
Okay.
So I said, why don't we take, because it's about an hour and a half from the cottage to there. So I said, why don't we take a ride up to Petawawa? Your mom's birthday was last week, and we'll go and see a great site and whatever. So anyways, we go up there, and he's like showing me things and sites and whatever, and like this is where mom lived, and this is where whatever. So then we get up there, 1.4.
1.4.
And he says, well, pull up, we're at the beach, like, anyway. And he says, pull up here, there's a fellow there, I want to talk to him. So an old guy fishing with his grandson.
Okay.
So we pull up, and he says to the old fellow, excuse me, do you live here? And he says, yeah, I live right across the road there. And he says, how long have you lived here? And he says, oh, about 40 years. And he says, well, I don't think that's long enough. He says, my mom is from here, and she grew up just on the corner of this street and this street. And the old guy says, I know you. You stopped me here last year, and we had this conversation a year ago. Like, what's the chances of stopping the same old guy?
What are the odds, eh?
But he talks to everybody.
Okay,
So
yeah.
the odds are probably pretty good.
I suppose
Because no
so,
one else
right?
would pull up and talk to anybody. I'm like, oh my God. And I started laughing. I'm like, you've got to be kidding me. The same old fella?
That's okay.
Yeah. Anyway, makes me laugh.
on, dropless next.
So 2 singles left?
2 singles.
2 left.
Yes.
I don't know if they're rights or lefts or both left.
So we're gonna switch around.
Post cataract construction, extraction, bilateral.
Okay. Oh, done. Okay, we're gonna do this severe cataract.
It doesn't say preservative free, Dr. Youssef, but,
But does it that's the correct one, no?
it's the right one.
Yeah. Bit of pressure.
Left.
Yeah. Give me a second here.
You already did.
Give me a second here.
Give me a second.
Certain steps I can't stop until they are completed, so. Okay, so show me the lens. So we have
Is it tight? Is your blood tight?
22.0
Yeah.
blue,
It
28,
sounds weird.
I don't know.
10.7,
I only need like
5,
half a
86. That's
cc
good.
or
Thank you.
a third of a cc.
I might have lost the, you know what I mean?
Yeah.
Always. Stacy, blue lane, last lane, 2, wait, wait. Try that again. Thanks for opening that lens, Nick. Good job, Limbo. Teamwork. Yes, sir. That's the only way to do it. No.
Text Connor or Zainab and tell him that we're in the last patient. Connor.
Yeah, we.
Uh-huh.
Well, they got 4 cc's. Left here.
Point 1.
Point 1, 0.1?
0.1.
Thanks.
Nick, do you have any more antibiotic there?
Yep.
bit of pressure. Sorry about that. I'm closing down, by the way, when we're done. Okay, all done. That's it.
The size one. Right circle it. Thanks. I did it on the last one too, Nick.
Some extra freezing, my dear. Gonna bite a little bit that one. Here it comes. Look at the light. Right, look at the light. Here we go. That's perfect there. Partha, do you have any question? We're almost done. Yeah.
I think I'm a Connor saying, so Dr. Charles just keeping me there.
Okay, that's fine. That's okay.
But yeah, I don't know. I learned a lot today. I don't think I've learned any questions.
Also, yes.
Yeah, until I do this unit.
Yeah. Anyway, if you have any questions, let me know.
Oh, for sure.
Yeah.
Maybe I'll go check out your YouTube channel.
Yeah,
I'll
go
get an
ahead.
answer from there.
Yeah.
How's it going? Have you used this thing yet? It's my new favorite thing in the whole apartment. It's, check this out. See how it's kind of coagulated? Zhuzh it up. I've been loving this. I'm so glad I came in here just for
I'll leave it here for you, Brandon. I'll leave you a few syringes and you play around with them.
Yeah, yeah, you can. Don't push too hard though, or else you gotta be like relatively gentle. Other way. No, that's right way. Never mind.
Yeah, I have to keep it loose a little bit so it moves.
Well,
Yeah.
Dr. Youssef, if it goes missing, you'll know who.
Brandon, it's all yours if you want it. I keep it in the bottom drawer in my
So pithy.
my cabinet. So.
I like it, right? It's the little things, you know?
2.1.
Okay, we're getting distracted. It's okay. It doesn't take much.
Whoop. That's not what I wanted.
Yeah, exactly. Yeah.
yeah, prior to the collapsible lenses, I know
It was
you had mentioned suturing before. Where would you suture the eye?
so it's you close the wound. So this incision is 2.7 millimeter. The other lens is about 6 millimeters. So you can open an opening at 6 or 7 millimeters wide. So it's not self-sealing at all. So you have to put sutures across this way.
Oh, really?
Yeah. So across from the cornea to close it down. So.
Do you use self-dissolving or do you have to take them out?
No, I have to take them out. We use nylon because it's less irritating and less inflammatory. So we have to remove them later.
They finish like earlier.
We lose that skill by the way because we don't do a lot of these anymore.
I was about to ask that next.
Yeah.
You did a simple interrupted suture.
Yeah, it is, but you tend to lose the skill after a while if you don't use it, and we don't suture hardly. I can't remember when was the last time I sutured the wound. Okay. Oh, done. Thank you guys for a good day.